Hey everyone, Dr. Ryan here from Fundamental Health. Today I wanted to shoot a quick video talking about a piece of research that I found very interesting. This is the research I'll be referring to, and I'll be quoting some of it as I go, but what this paper talks about is the role of nutrition, the role of diet, the role of lifestyle changes like losing weight and being active, and just these consuming less alcohol or not smoking, just these kind of changes that you can make in the prevention and also the ability to fight off cardiovascular disease. So I thought it was very interesting, and I wanted to highlight some of this. So what this paper refers to is a study done by the Hypertension Institute in Nashville, Tennessee. What they did is they took hypertensive patients of high blood pressure, and then they took patients with normal blood pressure, and they looked at their diet through the blood test that I'm about to explain. Hey Jim, how you doing? But they looked at this comprehensive blood test that I'll explain at the end. They were able to look at basically the diet. How you doing, Jordan? Basically look at the diet and the nutrients that were coming in and being absorbed and readily used. How you doing, Dan? And seeing just what's circulating through the body and then how that may correlate to cardiovascular disease. So basically what they found is people with normal blood pressure, they had a good or normal amount of certain macro and micronutrients in their body, and people with cardiovascular disease, they found a lot of deficiencies in as far as macro and micronutrients. So what they led them to believe is led them to do this paper and really assess what are we taking in diet-wise, how are these nutrients that we're bringing in, and how, if we're not bringing in enough and we're deficient, how that may be affecting your health and your cardiovascular health. So what they found that when they attacked and they went really after these people who had the low levels of deficiencies in the cardiovascular disease and the high blood pressure, when they went after them with lifestyle changes and diet modifications, what they found is that control of the blood pressure to the goal levels of 62% of the hypertensive population over 6 months, where they were able to completely taper and discontinue any drugs that they were on. These deficiencies will have an enormous impact on the present, future cardiovascular health and outcomes. So basically what he said is they did just some lifestyle changes and some diet changes and were able to get the person within 62% of the normal levels for the blood pressure and completely taper them off the drugs that they're on just by making these changes. So it's possible to get well within your normal blood pressure ranges, well within a normal as far as cardiovascular health by just making these kind of changes. So the mechanism of how this happens, the mechanism of how you're having hypertensive or cardiovascular disease, it all starts with oxidative stress and inflammation, which causes vascular smooth muscle, or the vasculature that makes up the veins and arteries, to spasm and do different things and deteriorate over time too. So what they talk about too is by having a proper diet, you can reduce the oxidative stress, you can reduce the inflammation in these areas and bring down the total load, which will then take the stress off the cardiovascular system and you won't have the disease you're having. I'm trying to sum all this up for you. There's a lot of technical jargon in here. But basically, he kind of reiterates over and over again that the optimal combination of macronutrients and micronutrients has a significant impact on the prevention, treatment, and potential vascular complications of hypertension. He recommends treating macronutrient and micronutrient deficiencies in order to effectively treat hypertension and related cardiovascular events. Hey Cody, how we doing? So it's about a 50 to 60% of essential hypertensive patients are excellent and appropriate candidates for what I'm talking about, making lifestyle modifications and improving your diet. Really the only thing he leaves out is if you have any significant risk factors that are not present at the time or present along the road that you're having when you're trying to recover from the cardiovascular disease that you have. You want to make sure you're working with a doctor, someone who specializes in cardiovascular disease, and make sure that you don't have any major risk factors. And if you don't, you're a very good candidate for just making lifestyle changes and improving your nutrition. So, as I promised, this paper, it's sponsored by a lab that I work with, and this lab has a very comprehensive macronutrient or micronutrient tests. So most lab tests that you go and let's say you get some blood work done and we're looking at your iron levels or we're looking at different nutrients in your blood. The only problem with these routine tests that you go and you have taken place is it's like a snapshot. So you can only see how the levels are in your blood and in your body and your system at that point in time. It doesn't give you an accurate picture of average what you're consuming and what is available to you at that time. So what this lab does really differently is we actually collect enough samples where I can see over 3 to 6 month period of time what you're bringing in. So it gives me a very clear picture of, are you deficient in something? Do you have too much of something? How is your diet? Are you lacking this? Maybe this is causing your symptoms. Maybe this is contributing to the cardiovascular disease. So like I said, this lab sponsored this paper where he goes into, you can see it's many, many pages. He goes into all the different breakdowns of certain nutrients if you're having deficiencies or you're having too much of this nutrient, and how it can contribute to your cardiovascular health, but your health in general. So what I really like about the lab, like I said, is I use this lab as almost a basic test, a preliminary test with my patients. I use it as a screening to see what your diet is like, because we've come to realize, and there's a ton of research backing this up, that if your diet is optimal, you're bound to be in better health. If your diet is suboptimal, you're going to have a lot of comorbidities. So I use this as a basic test to see what you're bringing in and how we can improve your nutrition, which ultimately is going to improve your health. So like I said, I want to take a couple minutes today, really go over the research I found very interesting. That was summarizing it up. Basically, if you're having any cardiovascular disease, hypertension, you name it, and you don't have any major risk factors, I would strongly recommend working with somebody who can get a clear picture. And the lab is SpectraCell. Sorry, I had a brain fart. The lab is SpectraCell, and it's a micronutrient test. I would work with somebody who can get a clear picture of what's going on with you, and then is able to make the necessary lifestyle changes by talking with you. And then once you have that clear picture of what your diet and what's actually being consumed and utilized in your body, going from those results, making the changes to your diet, and ultimately making a change for your health. So I hope this was of help. If it was, please feel free to share with anyone you think might benefit from this. I'm just trying to teach as much as I can. Take care and have a good night, everyone.